There is a massive increase in number of heart attack cases in India. India, it is believed, will even beat United States of America in the next few years as to the number of heart attacks. This is because cardiac disease or myocardial infarction is almost an epidemic in India thanks to the increasing number of diabetes, increasing number of people who are obese, that is, their weight is more than it should be, complete lack of exercise, as well as inappropriate diet, particularly having fast food, less of vegetables and organic food. And finally, but not the last, is excessive stress, either due to family problems or due to job, or most commonly due to both. Now, with this current trend, India already, as you know, has the largest number of diabetes in the world. And diabetes does not kill by anything else but by heart disease. So most people with diabetes would either have a myocardial infarction, which is called a heart attack in normal terms, or a stroke, or peripheral artery disease, which means their blood supply to the legs goes bad, which needs either stenting or bypasses in the leg. Some people even have their legs chopped off because their legs gets rotten when blood supply stops. So all these are complications of diabetes. So the commonest way by how a diabetic person dies is not by anything else, is because of heart disease. Added to that, the lifestyles of most Indians have changed considerably. Today, we have husband wife both working, busy with their job, lot of stress in the house. They have young kids to take care of at the same time. And at the same time, these together and lack of exercise, having inappropriate food, for example, just buying fast food and filling up your stomach, all of those add to increased cardiovascular disease. Complete change in lifestyle means doing some form of cardiovascular exercise, which could be a yoga or Pilates or Zumba, a couple of days a week, at least 4 to 5 days out of 7 days a week. Practice some sort of mindfulness or meditation on a regular basis. Yoga, as we know, is unfortunately not that. Yoga is not just physical exercise or asanas. Yoga is much more than that. Yoga has different breathing techniques, and these breathing techniques increase parasympathetic drive inside the body, thus preventing you from getting heart attack, which is more common when you have a powerful sympathetic drive. And even when you have stress in your job, which may be normal as part of your job, it does not affect you if you practice mindfulness and meditation on a regular basis. And that's where yoga plays a big role. Yoga is one lifestyle that combines everything. It has exercises which improves cardiovascular functioning. It has got breathing techniques that decreases autonomic super drive, which causes sympathetic nervous system to release dangerous chemicals inside the body. In fact, some of these chemicals can actually make you die suddenly. Even as you have seen, many young people have just died suddenly without any cause. And this is not only true for India, this is true for all over the world. Third thing is it has got mindfulness and meditation. And if you practice mindfulness and meditation on a regular basis, in 4 to 6 weeks, you can change your brain, which helps not only in anxiety and stress, but also in diseases like depression. So today, if you're depressed and you have a heart attack, your chance of dying is twice more than if you had a heart attack but you were not depressed. So it's very important to understand that heart and the brain works together. Changes in the brain caused by depression, anxiety, stress affects the heart. There's increased chance of having heart failure. There's increased chance of having heart attack. There's increased chance of having dangerous arrhythmias, some of which can cause sudden cardiac death. And what is sudden cardiac death? Sudden cardiac death means a person just dies suddenly without any rhyme or reason. Why does that happen? We really don't know. But what we do know is that stress can sometimes cause massive damage to the heart, including dilatation of the heart, producing heart failure. It can also make the heart to go extremely fast, which is called ventricular tachycardia or ventricular fibrillation, that can make people die suddenly. So it's important that you do what you want to do, achieve your career goals and everything, but they can only be done without a cost to your health if you follow certain basic norms. And the basic norms is having an appropriate diet. At least one meal a day should be on vegetable and fruits. Eat a lot of nuts. Avoid cooked food, particularly in mustard or coconut oil. Avoid fried food. Avoid junk food brought from outside. Try to eat as much as raw vegetables, salads, and other things. Have a regular exercise or yoga plan, which includes 4 to 5 days of light asanas, regular breathing practice, and regular meditation practice. With these combination, you can not only keep heart attack or heart disease at bay, but if you already have had one, you can prevent further attack or further disease progression.